Welcome to AAMG YouTube channel. We are so honored today to welcome our AAMG doctor. His name is David Tuan. He's our specialist OB/GYN doctor. Welcome, Dr. Tuan.
Thank you. And hi, everyone. And again, my name is David Tuan, and today our topics would be postmenopause. It's important to talk about menopause because it's an important milestone in our life. As we know, we have menarches, beginning of menstrual cycle, and we go through the menstrual cycles, and eventually it comes to an end, and we call it menopause. During menopause, as we know that the ovary will stop its function, and the egg production will stop, and the estrogen level will drop. And during menopause, we have different symptoms presented. And it's also important to mention that in menopause, some people like this, some people don't. And we should talk about the good things about menopause. For example, and people would complete their reproductive cycles, and they have no more babies. For some people, it's a relief, great relief. And also some disease such as endometriosis and dysmenorrhea. And now let's go to some of the slides. Let's look at slides 2. And it was giving you a definition of menopause. Menopause is a time when the menstrual period stops completely for more than 12 months in a row. Average age for menopause is age 51 in the United States. Before menopause is called perimenopause. And usually people experience decrease in estrogen levels, and the menstrual cycle occurs less frequent, and also the menstrual period will be shorter and lighter. Some patients might experience postmenopausal symptoms, usually a few years before the actual menopause. Why does menopause happen? As we know that everything have a beginning and also have an end. So menarche signified the beginning of reproduction, and menopause signifies the end of it. During the menopausal change, the body makes less hormones such as estrogen and progesterones. The ovaries stop releasing eggs, and the menstrual period slowly will go to a complete stop. Some of the symptoms present in the perimenopausal period, including irregular cycle, as we mentioned, hot flash, night sweat, etc. And these symptoms were getting worse and worse. Emotional swing, difficulty of concentration, insomnia, difficulty sleeping, decreased libido, fatigue, vaginal dryness. So those symptoms potentially were getting more and more severe, and usually is the worst during the first 2 years of menopause. After a couple years, our body slowly adjusts to the changes of the hormones, and the symptoms starting to ease up. The estrogen level stabilized, and our body was tuned into the changes. Some of the changes, it could be modified with the lifestyle, such as diet, the vitamin intake, exercise, etc. Some of the changes, such as vaginal dryness, it potentially get worse as menopause continues. And some people recommend to use vaginal lubricants. Maintaining a healthy lifestyle is important, regardless of your age. Premenopausal, postmenopausal, maintaining a healthy lifestyle is important, especially in the postmenopausal period. As we all know that after menopause, the osteoporosis is going to increase its risk. The calcium loss from the bone potentially could have a negative impact in our health, such as shortening our statures, and also have an increased risk of fracture in future. And also some disease such as coronary artery disease, stroke, it also significantly increased after menopause. Therefore, it's important for us to maintain a healthy lifestyle. And one of the lifestyle we need to talk about is food. It's very important to eat a well-balanced diet. as you can see on the plate, we should have a well balance of protein, carbs, fresh vegetable and fruits. Avoiding some bad habits. I think avoiding smoking. It should be good for all ages, young and old, men and women. I think everybody should stop smoking. Alcohol drinking, debatable. The recommendation would be consume alcohol responsibly with discipline and control. And as you know, that alcohol drinking for women, excessive amount could increase breast cancer. So the current recommendation would be have no more than 2 drinks per week. Again, one important life factor to watch out for would be getting adequate sleep and rest. And the recommendation is not to watch the YouTube too late. When you should consult your doctors for hormones or treatments. I would say in my general recommendation would be if any of the symptoms, perimenopausal or menopausal symptoms, that starting to affecting your quality of life, that would be the time that you should talk to an expert such as an OBGYN doctor for treatments. And some of the basic treatment could be starting with for diet, for lifestyle modifications, and some non-hormonal medications. And then if the symptom becomes so severe, hormonal replacement therapy will be a very good option. Be positive. Obviously, we need to have a positive attitude, and obviously have sharing experience with friends is important, but obviously we need to watch out who to share it with. Otherwise, there could end up in more trouble. But in general speaking, have anything you do, maintain your life to be active, and that would be highly recommended. Have a social circle that allows you to engage, keep yourself busy, and that's important. Okay, the last one would be question and answers. And again, thank you very much, and thank you AAMG inviting me to give this talk. If you have any questions, welcome to ask me.
Here's some questions from our audience. Were you able to explain the benefit and downside of menopause?
Okay, so actually the question is that some of the side effects, some of the symptoms of menopause, such as vaginal dryness, and how to treat that. My first response to that is, during menopause, in certain degree, almost everyone experiences some sort of dryness. And some people will have a worse symptom than others. My first line of therapy would be using some vaginal lubricants, such as KY gels, during sex. That would make the situation easier. But however, if people still experience difficulties, there will be an option to use some transvaginal application of estrogen creams, such as Astrace creams and permanent vaginal creams. Usually, we ask the patient to use 2 times a week, and over a period of time, the vaginal estrogen condition would be improved. Mucosa would have a more healthier mucosa in the vagina, and better lubrication, better elasticity, and the overall performance would be improved.
Excellent. So is there any other common questions that you often being asked in your prior practice?
Safety of hormone replacement. I think, for example, people always ask me, would estrogen be safe to use for postmenopausal symptoms? Mm-hmm. And my response to it, everything is risk and benefit, and depends on why you're using it. If your symptom of postmenopausal is not severe enough, my recommendation obviously would be stay away from hormone use, because there's a potential risk of increased risk of blood clots, such as stroke and coronary artery disease and DVTs, and also increased risk of breast cancer. But there's also benefits too, such as prevention of osteoporosis, decreased colon cancer, etc. will be benefit too. And also, people try to use the hormone for symptoms. And so far, I believe using hormone replacement therapy will be one of the best treatment for release of the postmenopausal symptoms. But we have to choose carefully.
So how long does it take for women to finish the complete cycle of menopause?
The menopausal symptoms, usually after cessation of the period, 2 to 3 years, people starting to feel improvement of the symptoms. It's no longer bother them as much as it used to be. Okay, and but again, it could be 2 or 3 years. It could be long for somebody. So therefore, somebody might want to have some help. As I mentioned earlier, that it depends on the degree that affecting your daily life. Once it affecting your quality of life, that would be the time to talk to a doctor for some intervention.
And why some Asian women usually don't have sweating issues versus other ways, but some Asian women still have it? What is the reason? Is it diet or lifestyle, or just ethnicity related?
Yeah, I think it's probably genetic. The different race, usually Caucasians, and might have more symptoms than Asian women. And it's just life. It's just everything. It's individually, even among Caucasians and among Asian, they might have different degree of symptoms. Someone just have worse than others.
I see. And how do you deal with the hot flash that they usually do?
Hot flash, people can use some dietary treatments, such as some plant estrogens, and sometimes they can use soy products, for example, tofu, soy milk. Even I saw where they have soy pills, and that would provide some relief. But some people, they think it helps a lot, but some people say it's no use. And also it would be very individualized. It was just an example.
And any other medical treatment for hot flash?
Yes, we do, but I recommend people to talk to their doctor. And I strongly advise people not to just do it on their own, because they do have side effects. For example, some people can use clonidine, the patch, and then put on the skin, and that would give a pretty good relief for the hot flash. But again, you have to assess the other overall health condition to use that.
Thank you so much,
You're welcome.
Tuan, for your valuable advice, and
You're welcome.
hope that you come back to our channel again.
You're welcome.
Yeah.
Be happy.
Excellent. Thank you.